Welcome to an hour of HealthMade Radio. HealthMade is a community for natural health seekers where we educate people about common health conditions and share extensive research on the most effective natural health treatments and promote legislation that protects our health freedoms. A core concept belief is in the innate intelligence and healing power of the body, and if properly supported spiritually, emotionally, and nutritionally, it can find its way back to health. HealthMade Radio will bring you information from integrative health experts throughout the world. Check us out at healthmade.co. Health is what you make it. I am Dr. Michael Karlfeldt, and I will be your host. Today's guest is Dr. Paul Harch. Dr. Paul Harch is a board-certified hyperbaric and emergency medicine physician who has become one of the foremost authorities in the United States on the use of hyperbaric oxygen therapy and SPECT brain-blood flow imaging in neurology. Dr. Harch is a graduate of Johns Hopkins University School of Medicine in 1980, and his hyperbaric career began in 1985. In recognitions of his accomplishment in clinical practice, teaching, and research, he was awarded fellowship status in the American College of Hyperbaric Medicine in 1997. He also received the Edgar End Award from the American College of Hyperbaric Medicine in 1994 and the Richard A. Neubauer Award for Excellence in Hyperbaric Oxygen Therapy in Pediatric Neurology in 2003. Dr. Harch is the first president of the International Hyperbaric Medical Association, established in 2001, and president of the International Hyperbaric Medical Association Foundation. He has lectured and presented his work at numerous scientific meetings throughout the U.S. and overseas. In April 2004, Dr. Harch was nominated and became a semi-finalist for the National Institute of Health Directors Pioneer Award. Dr. Harch, it's such a pleasure to have you on the show, and I'm so excited to hear more about what you have to say about this powerful medicine called oxygen. Can you give our listeners a little bit of an understanding, what is hyperbaric oxygen therapy?
It is essentially a treatment for wounds in any location in the body and of any duration. And it's comprised of two drugs, if you will, increased pressure and increased oxygen. And by repetitively exposing patients, depending on the time in the injury process, to hyperbaric oxygen, where with acute emergent conditions, it can only take one treatment, with chronic conditions, 40 or more, we cause the body to, or I should say, we affect expression of over 40% of all of the genes in our DNA. So this is really a gene therapy, and the genes that are activated and suppressed are determined by the amounts of pressure and the amounts of oxygen that we give.
So what kind of impact does this change in gene expression has? I mean, we always want to have happy genes. You know, we always want to heal well. We want to be able to fight infection, and we want to be young for as long as possible. So what kind of changes in gene expressions have you seen?
Well, you can break the 8,101 genes down into clusters. And the largest clusters of the genes that are turned on or expressed are those that code for growth and repair hormones and the anti-inflammatory genes. And the largest groups of the temporarily turned off genes are the pro-inflammatory genes and the genes that code for cell death. So every time you're going in a chamber, we are stimulating tissue growth, inhibiting inflammation, and turning off cell death. And when you do that, it has profound effects on a wide array of diseases because inflammation is an underlying problem for most chronic diseases, and wounding with death of tissue, or I should say injury of tissue, is another common underlying process or facet of many diseases. So this therapy essentially addresses and treats the underlying disease processes and indirectly then the diseases. And it's why it has such potential wide application.
So why do you think that this therapy is so underutilized? Because nobody really talks about oxygen as a therapy or hyperbaric oxygen therapy.
Because we've never been able to explain it until the past 10 years. This therapy began in 1664 in England with just compressed air. And through approximately the 1950s in the United States and worldwide, it was all with compressed air, with fairly extensive use, a lot of scientific publications. But it wasn't until oxygen was introduced into the treatment, into hyperbaric oxygen, such that it was compression with 100% oxygen, that people started seeing additional effects. And they were fairly dramatic. But the problem was nobody could explain it, such that if you took a chronic wound like a diabetic foot wound or a radiation injury wound and daily exposed it to hyperbaric oxygen, what was well known was you grew new blood vessels, new tissue, and you healed it. But nobody ever really looked at, and we weren't able until just the last 10 years or more to find out what could cause a cell to multiply and divide just by increasing oxygen and pressure. And once mass gene array analysis techniques came about in the 2000 range, they started to apply it to cells with hyperbaric treatment and realized that what we are in fact doing was affecting gene expression and suppression. So the problem overall has been we have not been able to explain our own therapy. And when people stood up and said, wow, it worked for this or for that diagnosis or a patient who had some problem, and they were challenged, well, how does it work? Nobody could explain it. And as a result, if doctors can't explain how something works, other doctors won't usually prescribe it. And that's been one of the fundamental problems with hyperbaric oxygen.
Because it seems like it's something that would impact then 40% of your genome, in addition to then the healing of wounds, controlling inflammation, tissue regeneration, and so forth, that the application of this would be massive. But when a patient comes into a medical office, the only time they would use it would be then for, like you said, wound therapy, diabetic wounds.
Right.
So,
well, yeah, that's been part of the problem. It is not taught in medical schools. One of my fellows 6 years ago did a survey of all the American medical schools, and what we found was 75% of them taught nothing in their curriculum about hyperbaric medicine. My generation of doctors, I was told in no uncertain terms, and I put the quote in my book, that this was non-science, fraud, charlatanism, etc. So, it's been misunderstood. It got somewhat politicized and mischaracterized over the application to multiple sclerosis back in the 1980s. Again, nobody could explain how it might work. And on top of it, the dictum in neurology was that you can't do anything for a chronic neurological condition. So here now, the fledgling hyperbaric medicine field was challenging 100 years of neurology and neurological dogma and doing it with a therapy they couldn't understand. So, it further got discredited, yet meanwhile, people kept applying it, trying it, and simultaneously doing research. And now the amount of research is just burgeoning. And we're finding it has more and more applications, pretty much like we had predicted for many years.
So now when we then finally can explain what it does, so what type of studies, what kind of research is being done right now in regards to hyperbaric oxygen therapy? What's the focus?
A lot of the focus is on neurological conditions. And it started primarily with our application to chronic traumatic brain injury. So I have done, and then the Department of Defense, and then Israelis, the Chinese, a variety of different researchers in different countries have done studies on chronic traumatic brain injury. In addition, there are additional studies on stroke. There is a big study underway in Europe looking at what's called avascular necrosis, which is stroke of the bone. It's where bones die. Most common is the hip bone, requiring hip replacement. And there's quite a bit of accumulating evidence that hyperbaric oxygen, if treated early enough in the condition, can prevent hip replacement. There's application to ophthalmologic conditions, to toxic brain injury, to aging, dementia, cognitive decline. So it's, a wide array of neurological applications. There is ongoing, continued application in many places to children with various forms of brain injury, despite the controversy in the scientific community about that. But there's also research in cancer and hyperbaric oxygen, coupled with what's called the ketogenic diet, which is a high-fat protein diet with no carbohydrate, and success being reported with that. And there's also some preliminary research on hyperbaric oxygen in conjunction with stem cells.
That's incredible. So going back, that's a huge list of different applications that are currently now being studied. So yes. In regards to the traumatic brain injury, the thought or stroke, the thought is that, once a brain cell dies, it dies. How can hyperbaric oxygen therapy restore function and heal the brain in that way?
Well, that's part of the mythology and the neurological dogma I was talking about earlier. That's what we were all taught, that brain cells are either alive or dead, there's no in between. But yet we know for a fact that cells exist in other organ systems in the body in a chronic stunned state where they're not as functional. This is true in particular for the heart, where you get stunned myocardium. Well, in 1990, my mentor, Dr. Neubauer, really turned the world on its ear, especially the neurological world, when he began to treat a 60-year-old lady who was 14 years post-major stroke, densely paralyzed on one side, had no oral function, drooling, couldn't chew, was fed by a tube into her stomach, and was in a reclining wheelchair, couldn't walk even with great assistance, and had no speech. And he did a brain blood flow scan, and the following day put her in a hyperbaric chamber and repeated the scan. In the area of the densest part of damage to the brain from the stroke on CT scan, the same area on the SPECT showed increased blood flow and metabolism after the single hyperbaric treatment. It turns out it was the area that controlled facial and oral motor function. And over the course of a year and a half, he treated her with hyperbaric oxygen and oxygen just by face mask intermittently at the nursing home. At the end of the 18 months, she was able to walk with assistance, was able to talk, was no longer drooling, and could eat by mouth. And the whole title of the article was "The Idling Neuron Letter to the Editor." In other words, brain tissue is not all dead or alive. You can have it in an intermediate stunned state. And through, in this case, hyperbaric oxygen challenge, these neurons could be made to function again. And I should say to be re-energized, if you will. Now, that's in addition to likely stimulation of growth of additional tissue.
That is incredible.
And that became the foundation for how we applied this for a full decade to hundreds of patients, looking with this imaging. And it's a very powerful demonstration. It's what we did in the veterans. It's what we published in case reports. And it's now what other groups have shown effectiveness with.
That is amazing. When we come back with Dr. Harch, we're going to hear more about the power of hyperbaric oxygen therapy. We'll be right back. Welcome to HealthMade Radio. We are here with Dr. Harch. We're discussing hyperbaric oxygen therapies. Dr. Harch, you were talking about the impact of hyperbaric oxygen therapy on neurons, on brain cells, and kind of discredit, or not I would say discredit, but educating the public about what takes place after stroke, what takes place after traumatic brain injury or concussion, where actually areas of the brain get stunned or they go into kind of an idle state. And there's not really that it's those cells are dying. They actually go more into kind of a neutral gear. And with hyperbaric oxygen therapy, you can then activate those cells and get them going and then be able to restore function where you thought that there's no ability to restore function in those areas. So that is amazing. What, in regards also, you mentioned things like cancer. Cancer along with ketogenic diet. I mean, we're shifting to another area. What does it do in cancer?
Well, it is somehow synergistic with the ketogenic diet. The ketogenic diet forces the cell to use and burn fats primarily. Cancer cells, however, in the process of becoming a cancer cell, one of the critical conversions that occurs to the cancer cell is a change in its metabolism to where it becomes primarily a fermentative cell. In other words, just burning sugar like you ferment wine without oxygen. And the cancer cell is hypoxic as well, low oxygen. So what happens with the ketogenic diet is you starve the cancer cell of its fuel, glucose, while forcing it to try to use and burn fatty acids like our normal cells do, and it can't do that. At the same time, with the hyperbaric oxygen, you are in that hypoxic environment initially, and then through the exposure to the high oxygen, causing an increase in oxygen-free radicals, which are damaging to the cell. There's also some evidence that the hyperbaric oxygen may actually force the cancer cell to burn glucose even more preferentially. So forcing it to use more of the substance you're starving it of while producing oxygen-free radicals, in fact, is injurious to the cancer cells. So what they've shown in animals now is when they give the ketogenic diet, the animals live longer with diffuse cancer before they die. And if they add hyperbaric oxygen to the ketogenic diet, they live even longer. So this is now being applied intermittently in various settings to patients. The early work is beginning, but it's actually been based on work that was done in the 1950s. And one of the first cases was just reported by a group of Turkish doctors who had a lady with a left breast cancer, full of cancer, metastatic to the lymph nodes in her armpit, and also to her liver and one area in her abdomen. And what they used was standard chemotherapy plus the ketogenic diet plus hyperbaric oxygen, and they also used hyperthermia. So they heated up her body while they were giving the chemotherapy. The idea is to make the cancer cells metabolize faster and hopefully take up the chemo and kill them. At the end of 6 months, they did a total body PET scan. There was no cancer detectable. And they were somewhat shocked. This was metastatic cancer. They decided that, well, they should go back to the primary source in the breast. There had to be some there. They'll remove her breast. They went and they did the surgery, removed the breast, sent it to the pathology. There were no cancer cells.
That is incredible.
It is.
One question that I have, I mean, most people, when they get cancer, they think, well, I'll do surgery, chemo, radiation, I will take care of it. So what you were mentioning here is that this treatment, obviously by adding hyperbaric ketogenic diet and hyperthermia, they were then able to get rid of get rid of it with that, which means that with the normal tools that people think are the tools that will take care of it, would not have been able to do that by itself. Is that correct?
Correct.
So so the impact then between chemo, radiation, and hyperbaric oxygen therapy, I mean, how do they potentiate each other? And how do they, I mean, they don't fight each other? Because most of the time you think either doing...
No, they don't.
Yeah, most of the time you think either doing traditional or more of the holistic or integrative medicine. It's very seldom do people think, well, I can do both. They either land in either camps, but they work very well together, I hear.
They do, and it appears synergistically. In fact, it's unknown exactly how the hyperbaric oxygen is facilitating effectiveness of chemotherapy or even with certain herbal therapies. It's not real clear what's going on there, except that very likely the hyperbaric oxygen is hyperoxygenating the tumor, which is normally of low oxygen, most solid tumors, and they grow in that environment. That hypoxic environment favors growth, which is why smokers end up with such increased risk for metastases and growth of tumors. But what happens is the hyperbaric oxygen somehow is beneficially interacting with both chemo and or herbal therapies. The effect with radiation, though, is known, and this has been well documented. In fact, there is quite a bit of literature on it. Radiation works by generating free radicals, oxygen-free radicals. So what's been shown is that the kill fraction, the percentage of the tumor cells that are killed, are proportional to the oxygen content in the tumor. Well, as I just said, and is well known, solid tumors have low oxygen levels in them. So when you irradiate it, you're not going to get the same amount of free radicals as if you do when the tumor is hyperoxygenated. And what's been shown is that you can get greater kill fraction when you deliver the radiation under hyperoxic conditions. Of course, you have to be a little bit careful because that also applies to normal tissue. And so it's a balance between the amount of oxygen and the radiation dose. You even have to decrease the radiation dose some. So there's a well-known synergy there. And, in the future, there will be more exploration of this and combination of those therapies.
Great. I want to expand on that a little bit when we come back in just a moment. We're here talking about hyperbaric oxygen therapy at HealthMade Radio with Dr. Paul Harch. You're listening to HealthMade Radio. This is Dr. Michael Karlfeldt. We're currently chatting with Dr. Paul Harch about hyperbaric oxygen therapy. Dr. Harch, you were talking about how hyperbaric oxygen therapy can be utilized while you're undergoing radiation therapy and also chemotherapy. And you were mentioning that the radiation therapy pretty much depends on that you have an oxygen supply into the tumor, and by using hyperbaric oxygen therapy, you can then increase that supply, which increases the kill of the radiation therapy. So with chemo, wouldn't it be very similar to that you need oxygen in order to be able to increase the delivery of the chemo to the inner core of the tumor?
I don't think it's quite the same argument. I think there is something else that is going on there, because increasing the oxygen supply, it must be the actual effect of the chemo on the cell processes. For there to be synergy, likely has to be oxygen dependent, such that by increasing the amount of oxygen, you likely facilitate the activity of the chemotherapy. I mean, that's just my mechanistic thinking and speculating, because I don't know. Well, who knows? There could be many ways that it does work, but it's been shown with a couple different chemotherapeutic agents. I think one of the studies was in breast cancer and the other was in colon cancer.
Yeah. Because from my understanding, we're going back to a lot of the metabolic therapies, like the ketogenic being a metabolic therapy, where we then try to resuscitate the mitochondria, and a lot of the cell death activities or apoptosis is triggered by the mitochondria. So, and I know the hyperbaric oxygen therapy, I would assume, have quite an impact on activating the mitochondrial activity as well.
It does. In fact, I was just pulling references last night for the lecture I'm giving in Denver at our annual conference. I'm giving a talk on hyperbaric oxygen in neurodegenerative disorders, so dementia and various other forms, Parkinson's disease, etc., Huntington's chorea, or Huntington's disease. And what is common to all the neurodegenerative disorders is inflammation and oxidative stress and mitochondrial dysfunction. And there are multiple publications on hyperbaric oxygen's effect on mitochondrial biogenesis, DNA, biochemical activity, energetics, etc.
So it almost seems like, I mean, the things that you were talking about, inflammation, mitochondrial dysfunction, and it almost seems like you have similar drivers for various diseases, whether it's cancer, whether it is neurological, like ALS, MS, Parkinson's, etc. So by addressing those factors, it seems like you can then impact all of these different diseases in some ways. So
exactly. In fact, you brought this full circle. It goes back to the definition and what I'm talking about. It is a treatment for disease pathophysiology or disease processes. And these basic disease processes are in many, many diseases. So, hyperbaric oxygen has been criticized as a miracle cure or touted as a miracle cure. Well, in fact, because it is effective in treating the underlying disease processes that underpin so many different diseases, in fact, it can be applied to many diseases.
Yeah, that's wonderful. So with going then, moving towards the neurological conditions, like you're mentioning the Parkinson's, MS, and so forth, and the impact of hyperbaric oxygen therapy on the mitochondria. So how does mitochondrial activity, or for listeners that are not familiar with the word mitochondria, it's the energy factory within the cell that produces our energy currents, so that the cell can function. So what does mitochondrial activity, how does that impact these neurological diseases?
Well, the mitochondria are the energy centers for the cell. And many of these diseases are caused by eventual damage to the mitochondria and subsequent death or disintegration of the mitochondria to where you get an energy-poor cell. The oxygen level in the mitochondria is 0 to 1 millimeter. So in air that we breathe, which is roughly 21% oxygen, the pressure of oxygen at atmospheric sea level is about 160 millimeters. So by the time it gets into our bodies and down into the center of the cell where the mitochondria is, that level is 0 to 1. So it doesn't take much of a perturbation to drop that level to 0. And have a mitochondria that's starved of oxygen. It's also the site of generation of oxygen-free radicals. So in the setting of injury and inefficient energy metabolism, there is increased free radical generation. And that is the driver of eventually cell death. So many of these conditions have underlying bioenergetic problems. And hyperbaric oxygen, if you go back to what I was saying, depending on the oxygen pressure and the absolute hydrostatic pressure, we are affecting so many genes, including mitochondrial genes. And the net effect is one that is beneficial if you get the dose right.
Because the mitochondria is pretty much the one that gives the energy for genetic repair. So by supporting mitochondrial activity, then you were talking about that, we impact about 40% of the genes. But it seems like with increasing the oxygen content to drive then the mitochondria, you have the ability then to have healthy genes. I mean, nowadays people are they're so aware about genetic dysfunction, and I have the genetic coding for such and such. I have a SNP, that will create issues in these different areas. So by supporting mitochondrial function, you will then minimize the poor expression or the bad expression of a dysfunctional gene.
Very likely. And I'll go this even one further. When I started looking at this in neurological conditions with our divers with brain decompression sickness and boxers, I made the statement that the single diagnostic category or genre of diseases that we would likely have no effect on were the genetic disorders. And it took me 6 years, and someone referred a premature aging patient to me, and we were able to demonstrate clinically and with brain imaging that we had an impact on this. I've now treated 30 or 40 genetic disorders, and what it speaks to is our effects on whatever the genetic abnormality is. The other effects of hyperbaric oxygen on our genome possibly can mitigate some of the defects in these genetic diseases. It was an eye-opener to me, but I've now got a Down syndrome child that we've treated, a colleague who's treated 8 or 9 of Down's patients. There is literature on treatment of retinitis pigmentosa, which is, as you know, a heritable disorder, and other diseases.
That's incredible. That's incredible. So we can then impact on the genetic aspects, and then also when I was listening to you talk at a conference a few weeks ago, you were showing all these SPECT scans that show the brain blood flow imaging. I saw the difference just between one therapy versus another, and you could see how a brain almost looking like a holy cheese, and then with a hyperbaric, you're actually then healing the brain, and then obviously that becomes part of the whole central nervous system, then impacting the neurological conditions that way, in addition to the mitochondria.
Correct.
That's incredible. So
the concept that was put out by a German neurophysiologist called Haussmann was the ischemic freeze. And what he showed and explained, and there was other literature to support this, is that, in the injury process, and let's just talk about the brain for a second, if you injure the brain, any tissue damage is going to cause inflammation. With that, dilation of blood vessels. The blood vessels, when they expand their diameter, begin to leak like a swollen garden hose. And the fluid that leaks out is put into the tissue, and it increases the overall tissue pressure. That collapses tiny blood vessels, and you get low blood flow and low oxygen in the area around the injury. Well, what happens is, as brain cells, blood flow drops, it goes through a series of stress stages. And this is documented. When you get to a certain point, the cell goes into what's called the ischemic freeze, where a certain part of its genome and metabolic machinery is shut down. And that gets to this whole idling neuron concept. But the cell does not die until blood flow is reduced another 40%. So this ischemic freeze, as it turns out, we believe by all of the SPECT brain imaging we show, and by now the cases and the studies, is that the ischemic freeze can be overcome with this pulse of hyperbaric oxygen.
Wonderful. We'll be back in just a moment. We're here at HealthMade Radio talking to Dr. Harch and the power of hyperbaric oxygen therapy. We'll be right back. You're listening to HealthMade Radio. This is Dr. Michael Karlfeldt. I'm here chatting with Dr. Paul Harch about the power of hyperbaric oxygen therapy. So, Dr. Harch, we've been talking about the impact of hyperbaric oxygen therapy in neurological conditions like Parkinson's, MS, and I would assume even things like ALS, and also autism is another one that I'm quite curious about. What have you seen in that area?
Well, the first series of autistic children treated in this country, I treated at my clinic beginning in 1995. And what I've found over the years is 70 to 80% of these autistic children will respond in a positive way with a partial, even progressive reversal of their autistic symptoms. In fact, we treated a severely autistic little girl about 10 years ago. She was, I believe, 8 years old. We just got a phone call 2 weeks ago, I kid you not, from her mother. She graduated valedictorian from a mainstream high school.
That is incredible.
Well, it just completely blew us away because I don't usually have long-term follow-up on the patients. We just don't have the staffing and haven't done it over the years. But if you go to the Autism Research Institute's website and an article now that's published on their questionnaire data to families, thousands of them, on all of the therapies that they have given to their autistic children. They asked them to rank them all, and they grouped them by biomedical and behavioral and blah, blah, blah. Hyperbaric oxygen was, I think, number 5 on the top 40 list, and their estimate was something like 65% positivity rate. Mine's been a little higher, but that's because I've looked at certain doses. So the answer is there have been a number of studies now, and unfortunately, some done not so well. But the controversy remains. Like many things in medicine, you have positive studies and you have negative studies, but I really have seen nothing that has the same results other than methyl B12 injections on ameliorating the autism symptoms.
So it almost looks like if you have a child with autism, hyperbaric oxygen therapy is a must. I mean, that seems to be, it needs to be a tool that's part of getting your child back.
True. And if you look at autism, one of the primary underlying pathophysiological processes is inflammation. And here we have all of this evidence now that hyperbaric oxygen is anti-inflammatory through gene expression and suppression. Makes sense.
Absolutely. And also, another area, we're talking about things like anti-aging. I mean, is hyperbaric oxygen therapy something that everyone can use, or is it just something for people that are dealing with chronic conditions?
No, it's something everyone can use, especially as we get older. I probably have now between 70 and 100 patients that I've treated with dementia. Alzheimer's, vascular dementia, common garden variety. And if your listeners go online to PubMed and do a search on dementia and hyperbaric oxygen, and what they will come up with is a new meta-analysis review article by a Dr. Perng, P-E-R-N-G. And what they did was look at all of the therapies for dementia, and hyperbaric oxygen and other alternative therapies were deemed to be the most effective and on par with certain drug therapies. So my experience has been one that, if we look at dementia, what is dementia? It is usually a cumulative effect of multiple insults throughout our life, whether it's alcohol, tobacco, drugs, traumatic brain injury, microvascular stroke, diabetes, toxins, pesticides, you name it. Eventually, we kill brain cells, we thin out the brain, we damage it, and it's essentially a microscopic wounding process. As I mentioned earlier, hyperbaric oxygen is a treatment for wounds, and that's what we found in the brain with dementia patients as well. And now other groups and people are turning out research showing the same thing.
So that's the biggest fear for most people as they grow older. I mean, that's the last thing we want to lose is our brain. But what kind of therapy, what frequency of treatments should someone do in order to be able to maintain and protect their brain from that kind of a process?
Well, that's not quite known yet. In other words, if you consider yourself totally normal, healthy, and so on, what is the frequency at which you could do hyperbaric therapy for wellness to maybe prevent some of these aging processes? It's not known. But what I usually tell people is by the time they get into their 50s or so, they ought to do a block of hyperbaric treatment, 40 treatments at a low dose. And they will very likely feel better when they're done. Once you tune into that feeling of wellness, on a longer-term basis, you can then intermittently dose yourself to try to maintain yourself at that plateau level. And it's individual variation in terms of amount of treatment and how long and so on.
Then we've been talking about chronic conditions. What type of treatment schedule, what type of frequency should people expect if they undergo hyperbaric oxygen therapy?
Well, for any chronic condition, we usually start with about 40 treatments. I'm talking neurological chronic conditions. And we see where we are at the end of that. We take a month or 2 months break, and then I go back and I dose them again. And you have to be a little more careful there because you want to go to plateau. It's not rote. And you treat patients to where they stop improving, and at that point you stop. And again, you take a break of time and you see how they do. And then you dose accordingly. And usually what happens is people get to feeling pretty good, and unless they have a chronic neurological condition and experience a little regression, you don't necessarily need to retreat. If they do eventually have some regression, it's small numbers of treatments, and it's almost like bouncing them up. We call them boosters based on the term that one of my early patients gave it back in 1992. And nobody knows the limit of where you can go with that. I mean, I'm finding it out over the years with more and more patients who call me back, but look at the story of my mother that I told about in my book, who was, very demented when we started treating her, and she was dying. She turned out she lived another 7 years with much improved quality of life. We didn't cure the dementia, but she finally died not of the dementia. She fell, broke her shoulder, and refused surgery, and just said, in her words, "It's time to cash in my chips." And she gave up the will to live, and in 2 weeks she died. But this was someone, she lived 7 years longer than what we had predicted based on her health at the time. And this was myself and my brother, who was a general surgeon.
Yeah, this is speaking about the healing medicine of oxygen, and all you listeners that are listening, I want you to check out Dr. Harch's book, The Oxygen Revolution. I've read it. It's an amazing book, and it talks about the power of hyperbaric oxygen therapy. Dr. Harch, I'm so thrilled to have you on the radio, and I appreciate everything that you do in the field of oxygen therapy and bringing it forth into the forefront of our mind when we're treating people with the chronic conditions and other situations. So that's all for today. I'm Dr. Michael Karlfeldt with HealthMade Radio. Connect with us at healthmade.co. Health is what you make it. Thank you very much.